Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Carlos Peñaherrera and Stephanie Mobley of Hamilton Diabetes and Endocrinology Center. Thank you for joining us today.
Thank you. Thank you for inviting us.
Dr. Peñaherrera is a board-certified endocrinologist, and Stephanie Mobley is a registered dietitian. Both are providers at Hamilton Diabetes and Endocrinology Center. Hamilton Diabetes and Endocrinology Center has 3 locations in Dalton, Calhoun, and Ringgold. They specialize in diabetes and thyroid treatment. Thank you for joining us for the show today. Today we're going to be talking about gestational diabetes. Can you tell us the definition of gestational diabetes?
Well, gestational diabetes is a condition that causes elevated blood sugar levels in a pregnant woman, and it can affect sugar levels in both mother and baby. There are many hormones that play a role in regulating the body's blood sugar levels, but during pregnancy, these hormone levels fluctuate and change and affect the body's ability to use the hormone known as insulin, which is the hormone that controls glucose levels. Without enough insulin, glucose cannot enter the cells, and glucose cannot be used for energy, and that will lead to elevated glucose levels in the blood.
Well, I understand. How common is gestational diabetes?
Well, according to the American Diabetes Association, about 10% of American pregnancies will be affected by gestational diabetes. So that's why we typically screen pregnant mothers between weeks 24 and 28 of gestation.
Now, how is this diagnosed? How do you find out?
We do a glucose tolerance test, which is a test that we use to determine how much your body responds to a glucose load after drinking a sugary beverage. And usually after that is confirmed for gestational diabetes, we aim to keep specific blood glucose target ranges for the pregnant women, including glucose less than 95 when fasting or before eating, and less than 122 hours after eating.
If someone has gestational diabetes in one pregnancy, does that mean they're going to have it in subsequent pregnancies?
Not necessarily, because every pregnancy is different. Having gestational diabetes in one pregnancy increases your risk of having gestational diabetes in future pregnancies. However, there are many mothers who do not develop further episodes of diabetes during future pregnancies. Unlike other types of diabetes, gestational diabetes typically resolves and blood glucose levels return to normal once the baby is born.
Now, what are the risks of complications associated with having gestational diabetes to the baby and to the mom?
Well, mother and baby both share the same blood nutrients, so when the mother's blood sugar is high, the baby's blood sugar will also be high. Some complications of this can include high birth weight for the baby, preterm labor, and low blood sugar after delivery for the baby. And gestational diabetes also puts both mother and baby at greater risk for developing type 2 diabetes later in life.
Oh, is that right? So later in life there is a risk?
For both, yes.
For both. Now, how is gestational diabetes treated?
So it is important to talk to your healthcare provider to determine the best plan for treating your gestational diabetes, both for you and your baby. Your doctor might prescribe insulin if your blood sugar levels are too high. Insulin is a hormone that helps regulate blood sugar levels, so by administering additional insulin to a patient's regimen, we can aim to control those sugar numbers to keep those targets that we discussed earlier. There are different types of insulin, and the doctor might put you on a basal type of insulin, and on top of that, give you some mealtime insulin as well. But those are the usually most common regimens used. There are some oral medications that we can use, but we strongly favor the use of insulin during pregnancy.
Dr. Peñaherrera, thank you so much. Stephanie Mobley is with us, and I understand that you're a dietitian. Is that right?
That is correct.
Well, that's fantastic. It's great to see you today, too.
Thank you.
We're going to talk a little bit about the diet that's associated with gestational diabetes. Tell me about that diet.
So it's not necessarily a diet approach per se. I like to focus more on lifestyle changes.
Okay.
So when I say lifestyle changes, what I mean by that is for a mother with gestational diabetes or any pregnancy in general, eating 3 meals a day and 1 to 2 snacks is very important. But also what's important is what those meals and snacks are made up of. So getting in some good vegetables, green beans, carrots, broccoli, bell peppers, cucumbers, salads, things like that. Also trying to get in more some whole grains. So whole grain breads, whole grain pastas, brown rice, some lean protein. So turkey turkey, chicken, beans, peanut butter, nuts. Essentially what this plate is going to look like with these different foods that I'm talking about, half of our plate, if you were to look at your plate, divided in half.
Okay.
Half of your plate you want vegetables, those green beans, the broccoli, cucumbers that I mentioned. The other part of the plate, a quarter of it's going to be starch. Starch is that whole grain, so whole grain breads, pastas that I mentioned, and the last quarter is going to be protein. So again, that's half the plate vegetables, quarter starch, quarter protein. Some meal ideas might be a sandwich. Maybe it's a turkey sandwich, and instead of having chips on the side, maybe we have some carrot sticks or an apple. Or maybe another meal idea, some grilled chicken with a small baked potato and some green beans. And then to give you some snack ideas, cheese and crackers, peanut butter and crackers, Greek yogurt, fruit, peanut butter.
I noticed you mentioned a baked potato one time, or a potato one time. So potato very high in starch.
That's okay. It's also got a lot of good fiber. That's why we're keeping that starch portion on just a quarter of the plate. But then the biggest half, the biggest part of that meal is going to be those vegetables.
I got you. I understand now. What about a lady who maybe needs to exercise? Is exercise an important part of this?
It is. So definitely she would want to talk to her doctor about exercise before starting an exercise program. But according to ACOG, pregnant women should get in 150 minutes of moderate exercise activity each week. This can be divided into 10-minute short intervals, or that might look like 5 days a week exercising 30 minutes. To give you some examples of moderate activity, walking, swimming, biking, something like that would be some good exercises.
I see. Now, if she has gestational diabetes, does this mean that she will always have diabetes?
Not necessarily. Like Dr. Peñaherrera already mentioned, typically our blood sugar levels return to normal once the baby is born, but it does put the mother at greater risk, up to 40 to 60% greater risk of developing type 2 diabetes later in life.
Type 2 diabetes. I understand. Now, if someone was maybe interested in learning more about gestational diabetes, what are some good resources?
Yeah, so some great resources are through our office. As we mentioned, we do have 3 locations. We offer classes. So we offer classes on gestational diabetes, but we also offer other classes on just nutrition. We have cooking demo classes, comprehensive diabetes classes. So if somebody has diabetes type 1 or type 2, they can also come to our classes. So they can call our office for more information on that.
Very interesting. Stephanie, thank you so much. Dr. Peñaherrera, great to have you back. Tell us a little bit about Hamilton Diabetes and Endocrinology Center.
Yeah, sure. We provide treatment for type 1, type 2, and gestational diabetes, thyroid conditions such as hypo and hyperthyroidism, thyroid nodules, and thyroid cancer, hypoglycemia, hyperinsulinemia, metabolic syndrome, adrenal and pituitary gland disease, parathyroid disease, and osteoporosis, polycystic ovarian syndrome. And we also provide diabetes management services like diabetic oral agents, insulin management of insulin pumps, continuous glucose monitoring, and diabetes management classes.
That's a one-stop shop.
Yes.
You guys cover it all.
Yes, we
do. That is fantastic. Well, thank you so much for joining us today.
Thank you. Thank you so much for inviting us.
I appreciate both of you all stopping by.
Thank you.
For more information about Hamilton Diabetes and Endocrinology Center, call 706-278-1622 or visit hamiltonhealth.com/diabetes. Offices are located in Dalton, Ringgold, and Calhoun. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.